Всем привет! Сегодня у нас в гостях наш доктор Зулкарнайн Хайдерхан. Сегодня мы узнаем о его пути становления хирургом, о его опыте работы в этой сфере и попытаемся развеять некоторые мифы, связанные с его работой, и также поделиться какими-то интересными медицинскими фактами.
Thank you so much. I'm a doctor. I'm a physician and a surgeon, and at the same time, I'm also a teacher. I love to teach medical students. I love to teach biology, and I have been in this field for around 8 years now. And yeah, I love it. I love my job. I love my work. I love my field. I love to treat people, and that's who I am.
Первый вопрос, наверное, будет, помните ли вы ощущение, когда впервые взяли в руки скальпель? Было ли вам страшно?
The first time when I went into the operation theater and I grabbed the scalpel, it's like a pencil. We grab it like a pencil, like you're writing something. I always say that surgeons, teachers, doctors, any profession, they are doing their job, but at the same time, they're also artists. So it's an art. So what I felt was like there is a person just below my scalpel, and it's me who is going to decide what I can do now. So at that time, it is so strange, so fearful, but at the same time, it is so, how to say it, so prestigious part of your job that God have given you an ability to treat the people. So I think that feeling is quite adrenaline drive, like you're on adrenaline drive. You are having, your heartbeat is so fast. And sometimes some people sweat also. Sometimes we feel exhausted. That's how we feel.
Yeah, that's great. Мы знаем то, что обычно в хирургических палатах операции длятся 6-8 часов. Как вы держитесь, да? Как вы держите свою концентрацию столько времени?
I think normally it depends on the different specialties. Like, for example, if we talk about the neurosurgeries, there are some surgeries who require 3 hours, 2 hours, but as you said, 8 hours, 9 hours, it is also possible. But in plastic surgery, if you go in plastic surgery, we have some surgeries which take more than 10 hours, even more than 10 hours. There was a surgery in which we were trying to remove a tumor, and we need to take a part, like it's called a flap. We need to take a flap. Yeah. We need to take a flap. We need to take some part of your body, and we need to put it on some other part. It took more than 1 day. But it's not like we are just standing there. Of course, we are humans. We also need to sit. We also need to drink or eat. So our life revolves around that table in that time period. So I think it depends on the team. If you have a good team, you have a good amount of people, a good amount of surgeons, doctors who are with you. So a surgery is not about one person, it's a teamwork. So if we have a good team, which is cooperative, and we can sit, we can stand, we can rest like that. So I think that's how it goes on. Normally, I think nobody can stand continuously for 8 hours.
Understandable, yeah. So we gotta switch.
Yeah, we gotta switch, we gotta sit, we gotta see. We have, it's not like we are doing a surgery in one go. There can be complications, there can be risks, there can be every single thing which you cannot even imagine. So it's a mutual teamwork. Without teamwork, you cannot conduct a good surgery.
What do modern surgeons use to train their skills before working with real patients? Is it true that grapes and chickens' legs are still used?
Yeah, they are still used. Like, for example, when I was in third year of medicine, we used to dissect the rabbits. We used to dissect the frogs. We used to dissect the cockroaches, the rats, cats, and cats also. especially the lab-grown ones, the lab ones. They're not like we are taking from the street and we are just cutting them. No, it's not like that. They are lab-grown, and we use them as a part of dissection to learn. So if we can do it in third year of medicine, I think it's not strange to use it even after graduation, after learning the skills on the animals, on chicken, on
Grapes.
on grapes or something like that. Yeah, we can use it.
Okay. Next question would be, так. Есть ли у вас или у ваших коллег особые ритуалы перед операциями, которые вам как-то помогают?
Whenever we are entering the operation room, we just say Bismillah. What else we can do? The rituals for moral or ethical values, we just try to give some respect to the patient. We try to give respect to the attendants. That's how it should be done. But I see at some places they just treat patients just like they are treating something dead.
Yeah.
But no, it's not real. It's not real. All the doctors who are surgeons, I can assure you that they are respecting the human beings, of course, because they're going to work and they're going to treat them. There is no special ritual like we say that. Yeah, if you're talking about the sanitization or hygiene,
No,
that's
not
a
that.
different thing. But if you're talking about the ritual, I think there is no specific ritual. Maybe if a doctor is Christian, maybe he will do like this, but it depends on the doctors.
Like, I don't know, wearing
what they
your
follow.
lucky clothes or something like that.
No, normally we don't have these type of things, that we have some lucky watch or some lucky scalpel. But we are lucky if we have a good team. Yeah, I think
So
that's the best.
It's all about the team.
It's all about the team.
Окей. Хорошо. Следующий вопрос. Сейчас все больше и больше появляются какие-то фильмы, связанные с медициной, там «Хороший доктор», «The Good Doctor».
The Good Doctor, yeah.
And so there's a question, is it close to the reality? Like, насколько сильно реальная хирургия отличается от того, что мы видим в этих фильмах? Насколько сильно отличается?
Basically, I think that it's not so close to the reality. What in the films, in the seasons, they are showing that there's a doctor, there's a patient, the doctor has diagnosed the patient, and srazu they are going to the treatment. After that, they're going to surgery, and after that, the patient is good. They're just showing you this thing, but they're not showing you that how the patient is recovering, how the patient can have some other complications of that procedure. Sometimes the medicine is not available. And sometimes if we see these seasons, they say that, oh, this patient needs a heart. Let's take a heart. And they do a heart implant. So I think that's not very close to reality. But yeah, there are some seasons which gives you a sense of diagnosis, treatments, protocols, and also about the doctor's life, what he goes through. So I think the most closely real life related season, if you want to see House MD, if you have seen, I think that's more closer.
House MD,
House MD. If you want to see something like that, maybe give it a try.
Okay.
It will tell you more about diagnosis and real life like scenarios, which we mostly experience. Yeah.
Понятно. И сейчас у нас получается эра технологий, и искусственный интеллект тоже уже является частью нашей жизни. Насколько сильно сейчас искусственный интеллект используется в медицине? Как вообще используют, да?
I think a lot of doctors are using AI nowadays. You're talking about AI, right?
Yeah, AI.
Artificial intelligence. A lot of doctors use it. I think it's not bad to use AI just for the diagnosis, just for the medication. That's a different thing. But I think if you want to talk more about that case, if you want to Just imagine, for example, if you don't understand something, or maybe because we are humans, sometimes some symptom or some sign which you see and you don't remember it, sometimes. You just go to AI, you learn it, that's it. It makes the life easier. But if you want to treat the patients with the help of AI, that's bad. That's, I think no doctor depends on that. Because sometimes if you write on AI that do you have a cough, AI will say that like what do you have with cough, like do you have a blood, do you have fever or something like that. It will diagnose you, it will help you to diagnose, but at the end it will give you some unnecessary medicines which you don't want. Only a doctor can help you understand which condition you have. Yeah.
А если мы будем говорить более масштабно, например, сейчас, получается, ходят исследования, и вот этот искусственный интеллект, он внедряется в исследования. Его тоже используют как машина, которая делает механические задания, задачи вот эти вот. Например, недавно что-то связанное с ДНК, либо с протеином, то есть он составлял рандомные вот эти вот комбинации, да?
Yeah.
Вот насколько это сильно сейчас помогает медицине?
I think in some cases it can help too much. Like I was reading an article, there was a person, his dog has a cancer, and he used to do the genome. He paid money for the genome of that dog, and then he gave that genome to the AI that checked for the mutation. Where is the mutation? And it checked the mutation. He took that code, gave it to the vaccine center. They made a vaccine, and they gave it to the dog, and the dog is now living a good life. He don't have a cancer right now. So I think in a lot of cases AI is helpful, but if you just depend on the AI practically, like 100%, that only AI will do stuff for us, I think that's not a good option right now.
Yeah.
It do not have that human instinct in it. It just has a lot of books in it. But what AI is missing, it's missing a good, a gentle hand, a gentle care.
Okay. That was a great answer.
Yeah.
Наверное, этот вопрос будет интересен для студентов-медиков, либо же для школьников, которые хотят стать медиками, хотят работать в этой сфере. Правда ли, что студент-медик забывает о личной жизни на 6-10 лет, или это преувеличение? Is it true that medical students sacrifice their personal lives for 6 to 10 years, or is it an exaggeration?
I think it depends why you want to be a doctor. This is the first question which every medical student should ask his or herself before entering a medical school. Why they want to become a doctor. If they have a clear vision, it doesn't matter that if they're sacrificing their personal life, if they're sacrificing themselves or whatever, like they think that there is an exaggeration. Like, for example, if I tell you about myself, when I was in medical school, how I used to revise. When I go to toilet, I used to put the sticky notes on the door of the toilet. And when I was sitting, I was reading them sometimes. So I adjusted the study with my personal life. So I think it's not too much like how we think that the students are exaggerating their personal life and they are at extremes or something like that. I think it depends from person to person. That if you are able to manage that kind of stress, because if you're not able to study the IGCSE biology book, I don't think that you will be able to handle that much stress of big books. So I think it depends. You have to try to manage and train your brain. You have to train your brain. You have to ask yourself why you want to be a doctor. If you say, oh no, my parents want me to be a doctor, then I think you should consider your vision again. You should consider your ambition again. Don't be a doctor just if someone wants you to be a doctor. Be a doctor if you have a feeling that yes, I can do it. Yes, I need to treat the patients. Yes, I have that stamina to work in this kind of space. Only then you can handle the stress. There will be no exaggeration. There will be no pain. But when they say there is no pain, no gain, that's also true. But yeah, you have to be, the basic word for each thing which I just talked is endurance. You have to increase your endurance. If you have more ability to work under some specific conditions, I think that's where the truth lies.
Yeah, да, правда.
I think on a lot of Instagram or TikToks or posts, you see that there is some person who is saying that I haven't slept for 8 hours. I think that's their exam time. That's not the normal routine, right? You understand that in the night they are studying. Why you're studying in the night? You should study for whole year. You know what I used to do? I used to study whole year good, and at the exam time I was watching movies because I was exhausted of studying. I used to watch movies. I used to go out with friends during the exam time. But for the whole year, I was good at studies. So I think it depends. But what they are posting is, it is not in comparison to medical students. It is in comparison to engineering students. It's in comparison to art students. Like, just imagine, there is an art student who studies for 3 hours in the morning, or 4 hours, 5 hours, or 8 hours in the morning, and then they do a normal life. But medical students, they have 3 hours classes, maybe, for anatomy, physiology, biochemistry. After that, if they are living somewhere outside, they have to make their own food, they have to work for themselves, then they have to revise. So, yeah, you cannot compare that this student is studying more, this student is studying less, but you have to compare all the medical students together from each another. Yeah.
So it's about just medical students.
Yeah, just the medical student. If you just talk about medical students, it's normal. It's nothing more. But if you compare it with an art student, of course it is more. Yeah.
Хорошо. Так, теперь мы хотели бы узнать о том, как вы стали хирургом, именно вот этот процесс, да, становления, как вы учились, как вы вообще смогли преодолеть, да, это все. И хотели бы побольше узнать о времени, когда вы вот были в университете.
For how long I have been studying?
Yeah, for how long? And I also have been told that you studied in China.
Yeah.
And мы хотели бы узнать про это тоже.
You also want to know that?
Yeah.
So my journey started in 2014, and I think I'm still on my journey. A doctor, or I think anyone, is always a student. It depends that are you still in a mode of learning or not. If you want to learn, you can even learn at 50 years of age. So it do not depends that from what time you start learning and now you are complete. No, I'm not complete. I still don't know a lot of things. Like in the life, like I don't know about the engineering things. You cannot know about everything in one life. So I think you should always be open to learn. So my journey started in 2014. It was the first time when I was going out of home, out of the country actually, and I went to China. I studied there, and when I graduated, I came back, and then I also attended here. Also, I came here. I did my MD here, and then I went back to my own country, where I practiced the surgery, the medicine, and treating the people, and I started my specialization there. And yeah, and after that, I just worked, and you had a number that in this subject I got this many points, in this subject I got this many points. So when I was working in my own country, we had numbers that I did this much surgeries, I checked this much patients, I did this much procedures. So we had these things, and it was interesting to count that how many times we have done some specific procedure. Yeah. And IV line, babushka, the one which you give intravenous, a needle which you put in the vein.
Needle, yeah.
You know about that? For Kapelnitsa, they put it in the vein, the needle.
Yeah.
I did that, I think, around 3,000 times.
3,000.
Yeah. I just used to count it. That was a strange thing, or I don't know what, but I just used to count it. So, so it's not about just reading the books. It's also about the practice. The more you practice, the more you chase the perfection. And a good doctor or a good surgeon is not a surgeon who has done a lot of surgeries. A good surgeon is the one who do it while chasing the perfection. It's not about that doctor has done a surgery quickly in 2 hours as compared to the doctor who is doing that surgery in 5 hours. No, you cannot say that surgeon is good because they are doing the surgery faster. No, you cannot say that a good surgeon. You can a good surgeon means who knows about what he's doing, who knows about their patients, and who knows about the respect, how to respect a tissue. If you know how to respect the human tissue, I think you should go for that doctor. You should go to that one. Yeah, that's how my journey started, and that's how. And I had two dreams. My first dream was to become a doctor, but during the med school, I started teaching medical students also. When I was in second year, I was teaching first year students. When I was in third year, I was teaching second year students. Yeah, tutoring. When I was in fourth year, I was teaching third year students. So by that thing, when I graduated, when I became a doctor, and then I thought that why I should not teach? I should also teach like that. I'm also good at it. So that was my second dream. That was my rebirth. I born again, and I also started teaching. So yeah.
Это очень классно.
Yeah, thank
Смогли,
you so
да,
much.
достичь двух целей.
Yeah.
Понятно. Значит, вы побывали в 3 странах, значит, вы имеете опыт работы, да, в этих 3
Yeah.
странах. Получается, Кыргызстан, Китай, Пакистан, да?
Yeah.
И какие вообще различия есть в медицинской сфере в этих странах?
Here, if you talk about here,
Like differences.
difference here or overall?
Overall, like in China, Kyrgyzstan.
Okay. So in China, technology. There's too much technology. You will be amazed by looking at the type of care which they do. You will not see a lot of people sitting around the patient. Like if here or in Pakistan, you see there is one patient and a lot of people are sitting around them that, oh, we are here to ask you. And no, in China, there is only one patient in the room. The doctors, the nurses, the staff, they are taking care of themselves. I have a lot of friends in China who are still working there, and they have very good quality of imaging, of radiology, of a lot of different techniques. There are some tests, some blood tests, which are not available in other countries, but they already have like gained that thing. If we talk about Kyrgyzstan, there are a lot of things like there is no proper emergency treatment, emergency medical thing. Plus that there is a very distinguishable way in treating the foreigners and treating the locals. There is a distinguishable way, like you cannot.
Ой, то есть в плане расизма или как?
Not in the case of racism, because in the case of emergency, like trauma, acute trauma. Like for example, if some foreigner is dying, there's a different procedure for that to go. But if some local is suffering, there's a different procedure. But both of them will go to the same place, right? But with different procedures. But if you talk about in Pakistan and in China, you will see that emergency, they deal it the same way. They will take that patient, they will take it to the hospital, and they will treat them. Plus that, one more thing. In my country, in Pakistan, if you have some patient, you have some medical or surgical emergency, it's free. It's free. Free. Бесплатно. But here, you have to pay. If you are a foreigner, if you are Kyrgyz national, you have to pay. But in Pakistan, you will not pay for this thing.
Для всех, да?
Yeah. Even if you're a foreigner, for example, if there is a Kyrgyz in Pakistan, he got into some accident
Мгм.
or something, he will call the ambulance. They will come. They will take him to the hospital. They will treat him. They will give some medicines and whatever thing are needed. They will do it free.
М,
Everything is free, like that.
Понятно.
And we have the most quick respondents in our countries. Yeah,
Да,
that's
классно
that's
очень.
the difference which I see. But related to the treatment, I think here doctors are also working here. Doctors are also working in China, in Pakistan, and the surgery in these countries is good. They know how to do a surgery, and here I like a lot of doctors here. I have some friends who are surgeons here in Kyrgyzstan, and they are very good at it. They're very good at it, and I love how they work. Yeah.
Понятно. Хорошо. И еще один вопрос. Наверное, это про профдеформацию. То есть стали ли вы в обычной жизни более осторожным или тревожным из-за вашей работы хирургом? Has your profession made you more cautious or anxious in everyday life?
Yeah, it has too much. Like, um, I don't want to tell this, but sometimes, like when I touch unnecessary things, I have a thinking that maybe it has some germs, so I wash my hands. It's not an OCD, but I think it's normal. It should be done normally because I have seen the people who don't wash their hands and they eat and they get infections. They get gastritis or gastroenteritis or something like that. But for me, it has became like made me more cautious, like about the daily life, like how we have to be careful, drink more water, because I have seen the people who are suffering from kami, pashki kami, like stones. I have seen those patients, so I drink more water.
В этом плане.
Yeah. So I see patients who have gastritis, so I wash my hands. So I have seen patients who have different other conditions. So I try to avoid those. Like for example, I see patients who drink more sodas, who eat more candies, more sweet things, and they have big belly and they are diabetic. So I try to avoid sweets. So these things make me more cautious about my life, like how we have to spend it. I have seen patients who have very chronic constipation, chroniczewski zapor, and I try to eat more ovoshi fructi, so I have more normal metabolism. So these are the things. These are very normal things that made me cautious for about how to live and how to live my life.
Повлияло, да, на вашу, на ваш образ жизни?
Yeah, yeah,
Понятно.
yeah.
Хорошо. И давайте теперь проведем небольшой блиц.
Okay.
Блиц вопросы для нашего гостя. Так, можете рассказать о самой долгой операции в вашей практике?
The longest
Yes,
operation
what was
which
the longest surgery?
yeah, the longest surgery which we have done, it was a free flap.
Free flap.
It was a free flap. When I was working in plastic surgery department, we had to take because there is a tumor here. There's a tumor here of mandible bone, and we had to remove that tumor. And when we remove it with the bone. So we removed that, and then what we had to do, we have to take the bone from your leg. It's just called tibia, tibia and fibula, right? There are two bones in the leg, and we had to take the fibula, the smaller bone. We had to cut it from there with skin, with the blood, with the vena, arteria in it. We have to take it, and we have to put it here. So for that, we have to remodel it for a lot of time. So that surgery went for 21 hours. 21 часов. And it was so long. I was not working all the time. I was sitting. Sometime I was scrolling. Sometime I was drinking water. But sometime I was standing there. I was helping. I was working. So it's a teamwork. It's not one person's work. It's a teamwork. So yeah, that was the longest surgery. But you have to be there. It's not like if you are done, your part, you can go. No, everyone has to be there at the same moment. Yeah.
Понятно. Следующий вопрос. Так. Что самое сложное в вашей работе, кроме самой медицины? Например, бумажная волокита. То есть, what is the hardest part of your job besides medicine itself? For example, paperwork.
The paperwork is sometimes challenging, sometimes, because sometimes we have to document everything. We have to write what patient is coming from, and I think it's good. It's good to do it, but sometimes it makes the work slower. Like we are still working, but still there is some unnecessary paperwork which we have to do. I think in the life we are in the era, in the time which we are right now. In this time, the AI has came, a lot of digital software has came, so we should digitalize everything. We can do it easily, and it will reduce our workload in every hospital in the world. So that's the only thing maybe which is a little bit challenging, except paperwork. Plus that, I don't think like there is something else which is more challenging itself. The medicine itself is so challenging sometimes. So yeah.
Хорошо.
Plus that, one more thing which I want to add, the myths which people come with, they are so much challenging sometimes.
Myths?
Myths, the myths.
Myths.
Yeah, the myths. Like somebody, like some old lady said that drink lemon every day. It will give you this, it will give you that. Why? Drink lemon normally. Why you have to drink it for 14 days or 10 days? Like that. There are a lot of things which we have to deal with. People are coming and coming with different conditions. So I think that's also a challenging part of our profession. So yeah.
Понятно. Хорошо. И следующий вопрос. Один совет человеку, который завтра ложится на плановую операцию и очень боится. То есть какой вы можете дать совет? One piece of advice for someone who is about to undergo a planned surgery tomorrow and is very nervous.
Somebody who is very nervous and is going to undergo a surgery tomorrow.
Yeah.
Maybe I will say, don't worry, trust your doctor, trust your God, and trust yourself that you will do it better. Because there is a risk everywhere in every operation, but your doctor is there for you and he's trying his best to save you. Don't worry. Just do what he says. Like if he asks you don't eat, don't eat. If he asks you don't drink now, don't drink now. Just follow the advice and follow the procedures accordingly. You will do good.
Что вы можете сказать людям, которые боятся, что они проснутся во время операции? И как вы вообще работаете с анестезиологами в этот момент?
So I think that's what I told in the very start. That it's a teamwork. We have a team from anesthesia. We have a team from surgery. Or maybe we have a team from some other department also. So they're working together. We have some magical medicines which can make your muscles relax, which can make you sleep, which can make your pain give away, like your pain vanishes away. We have different medicines for that. Plus that, the anesthesiologist and the surgeons, they are coordinating with each other. At what time should we give anesthesia? At what time should we start the surgery? And at what time the patient should go to sleep? And at what time he should come back? So everything is coordinated. So I think there's no need to worry about these things, that when you will wake up, there will be too much pain. Yeah, there will be pain, but the scale of pain will be less. It will not be too much like that, because you have already been given painkillers, the medicines. So I think don't be too nervous about that thing. I will ask that patient who is going to have a surgery tomorrow. Don't worry.
Значит, они боль все еще будут чувствовать, да?
Yeah.
Просто
less, because they have given you anesthesia. Anesthesia is a strong medication. It will block your pain receptors for some time. After some time, when you wake up, after some time, maybe you feel a little more pain. but they will again give you some medicine. So that's why when it comes to the medicine, we say take it 3 times a day: morning, evening, and afternoon. Right? Morning, afternoon, evening, 3 times a day. Why we are giving 3 times? Because we know this medicine effect will go off. Again, you have to take it. So that's what is going after the surgery. It's all about medicine, which we are giving after the surgery. So yeah, it's like that. Okay.
Red-haired people need more anesthesia. Рыжим людям нужно больше обезболивающего. Это правда или нет?
No, it's a myth.
Left-handed students are forced to retrain to use their right hand. Леворуких студентов заставляют переучиваться на правую руку. Это правда или нет?
In some countries, in some cultures, they do it, but normally it's okay if you're left-handed.
All surgeons can sew clothes since they stitch people. Все хирурги умеют шить одежду, раз они шьют людей.
I think no.
After surgery, a person under anesthesia always talks nonsense and reveals their secrets. После операции человек под наркозом всегда несет бред и выдает свои секреты.
It depends on the type of anesthesia. There is one type of anesthesia in which the person hallucinates and they tell their secrets. Yeah, it's true.